Siddhanta, it is like Ardha Chikitsa. You can treat the patient just by learning the Siddharthas. So, with your class also, it is very much evident that from Siddhanta you can directly go into a very good Prayoga also. Thank you so much, sir. Thank you very much. Sir, now with your permission, can we go for the discussion part, sir?
Yeah, certainly.
Okay. Sir, we have few questions that has come in the chat box.
Yeah.
So I'll read it out. Sir, first question. In Navajwara, Kashaya Kalpana, we should not use. Then why we are giving Shadanga Panya?
See, it is not Kashaya Kalpana, and Charaka has very explained it. Ekkasha न तु कल्पनमुद्दिश्य कषाय प्रतिषिध्यते यः कषाय कषाय स्यात् स वर्ग्यस्तरुणज्वरे. You can understand, I think.
Yes.
न तु कल्पनमुद्दिश्य कषाय प्रतिषिध्यते. कषाय कल्पना is not contraindicated in the jwara. यः कषाय कषाय स्यात्. कषाय रस संयुक्त कषाय क्वाथा is contraindicated because कषायः Kashaya Kalpana, not Kashaya Kalpana, Kashaya Rasa creates Malastambha, and the evacuation of bowels will not be proper, so that Kashaya Rasa Kalpana is contraindicated in Navajwara.
Sir, next question. How to treat Hasta Pada Daha? Most of the patient after giving Tikta Pajana and Pitta Shamaga Kalpana, it will not reduce. Both obese and thin patients, the doctor has seen it seems.
Yeah. Okay. When you get Daha, you have, first we will think that it is due to Pitta. Because Daha is the symptom of Pitta. So we have to find out whether it is associated with Kapha or Vata. So maybe sometimes Vata may be there in the degeneration conditions where Vata is increased. It will take the Pitta to the some the sthanas that is called as Ashaya Apagarisha. Dhadukshaya Janya Daha will be there. In Rajeshwara Daha, it is due to the Vata only. Vata and Pitta may be sometimes increased or Pitta may not be increased. Due to Vata increase, it takes the Pitta to some of the organs. In such conditions, we have to find out that it is due to Vata, and when Vata is treated, the Daha will come down. If there is a blockage due to Kapha or something, we have to relieve that condition so that Pitta will be decreased. Pitta will come to the Koshta and can be by Virejana or etc. we can relieve. So this association also we have to think. Not only the thing symptoms, which dosha has been associated with that, accordingly, in Vata Paitika, Ghrutapana is advocated. That is why Kashaya Panapathyanyir Dashaha Iti Langide Sakpir Dadya Kaphe Mande Vata Pitto Jare Jare Vata Pitto Jara. So these conditions we have to find out and accordingly treatment.
Okay, sir. Thank you. Sir, next question. How Anuvasana is Vayu and Astapana is Akasha and Nasya is Prithvi? Can you please comment on it, sir?
What is the confusion in it? I don't understand.
Actually, Dr. Swati has asked it. If Swati is here, you can please unmute and talk to sir.
There is no confusion in it. It's according to Panchabhutas we have told.
Yes, right, sir. Okay. Swati, you can speak to sir. Hello, Swati. Okay, sir. Anyway, we'll go into the next question. Sir, it is a question from Dr. Ujjwala Shelar. She is asking that she has a patient of Anidra, same as a case you told her. Both kids are studying in US. Because of Anidra, she gets headache, Brahma, and doctor had told her to do Shiropiju, Abhyanga, Saraswata Arishta. Her headache and Brahma has reduced, but still she has Anidra problem. What will be the line of treatment? Her kids can't come here as you said in your case.
Yeah. See, we have to find out the subtle causes behind it. So, if and for that we have to do a counseling of the patient, and there should be an intimacy between the patient and doctor, so that she will tell what the causative factor which hurts here. So we can find out solution for that accordingly. If she has some problems with son, daughter, or family, etc., we can talk with them also, and they may not be knowing this is the cause. So it can be by family counseling. It can be arranged. See, Pitta, Chikitsa itself, Acharya tells about it. Even the hearing of sounds of the children, the mind will be pacified and pitta will be decreased and maintain equilibrium. So that is very important. Even if the wife is very much good relation we have got with the wife, it will be a chikitsa for pitta. So these are the, so we have to find out these are the causes for pitta vitiation, and accordingly we have to do it.
Treat it. Okay, sir. Thank you. Sir, next question. Dr. Manoj Kumar is asking, can you please describe the treatment protocol of the spinal artery stenosis that you had shared?
Yeah. I told you, the patient was having incontinence of urine and also feces, and she cannot even move the fingers like in the tarsals, etc. And so, at that conditions, we were admitting her in the modern hospital itself, and we were advocating medicines. See, first we gave Intugantam Kashayam with Gorojanadi Gudika, and also Ashwagandha and Dasamula Arishta also. And the main treatment is this only, Indugantam Kashayam. And after some time, we switched on just by seeing the conditions. We mixed Indugantam Kashayam with the Mustadi Marma Kashaya. This is one Kashaya which is used in the conditions of Vadiga disorders we were using, and also Gulgulittan Kashayam also we were using, and Matravasti was continued for 2 months, and I think by the medicines and also the Vasti, Matravasti, the Vadanulomana has occurred, and after that she was able to move her legs, and also now she is walking also, no problem. She is doing her duties.
Okay, sir. Thank you so much. Sir, I would just request one of our participants who have raised the hand to talk to you.
Yeah.
Abhinanda. Abhinandan. Dr. Abhinandan, you can speak. Hello, Dr. Abhinandan. Yes, you can speak. Hello, Abhinandan. Dr. Abhinandan.
Bishop, Osanda का किसका है?
I'm sorry, sir. He's not. Sir, we'll go to the next question. Sir, in Pitta Kafaja Jwara, how Shita and Ruksha Dravya be selected? As Shita Guna can deviate Kapha also.
See, that question was, yeah, there is a condition of some that is samsargaja vyadhi, where kapha and pitta may be increased. In such conditions, we have to treat both the doshas. So there are some medicines which are prescribed for samsargaja vyadhis. In the text itself, it is explained. So the question or the doubt may be, if you pitta increases, kapha will decrease like that. It is not like that. Both may increase in such a condition. That is why samsarga vyadhi occurs. And it is explained in the, we should know the text that is Rasavaisheshika. He explains about it. The one dosha increase, though they are opposite, may not essentially decrease the other doshas. Both can stand. Like gunas, some sattva guna, rajoguna, and tamoguna, though they are having different gunas, the sattva guna and rajoguna can increase, or rajoguna and tamoguna can increase. So
Right.
that is there in the body, and essentially it cannot be told that one dosha will decrease the other doshas. That doesn't happen in the body.
Okay, sir. Thank you. Sir, next question.
And one thing also, the kapha increase occurs by ushna guna. Prakopa of kapha is occurring due to ushna guna. In Vasanta Kala, ushnena kopam, kaphatinte the kopa of kapha occurs by ushna guna.
Right,
Okay.
right. Sir. Okay, thank you, sir. Next question. Sir, Dr. Vishakha is asking for lactose intolerance. What is the alternate treatment? Example, Tikta Kshira Basti or anything.
Lactose intolerance, we have to avoid milk. That's all the things. But if you treat with some, I have not got that experience of lactose intolerance treatment. Still, if we try for some of the changes in the body, which creates the lactose intolerance, when we treat it, the causative factor, it can get some results sometimes. I have no clinical experience about treating lactose intolerance test, but we can try for that. I did not get such a case to be treated. We tell that you don't take milk. If that is the better remedy we can adapt.
Right, sir. Right. Sir, another question. The selection criteria for Amrudottara and Dashamula Kadutraya Kashayam, how to select in which roga or avastha?
Yeah. Amrudottara, it has got 3 medicines only. One is Amrita, and also that is Chukka, that is Shunti, and also Hari Pranada, that is what do you say, Triphalas Kadika.
Vibhidagi.
These are the 3 things. So in Amrutottara, that gives Malashodhana very well. But the Dashamula Kadutraya will not give Malashodhana. So when there is a need of purification, and relieving of ama, through a purificatory process, we can use Amritottara Kashayam. So, ama will be relieved and also evacuated from the body. But Dashamula Ganutraya is different, where it may be sometimes sangrahi. So, in such conditions, where kapha is too much and adhisara is occurring sometimes, in such conditions, Dashamula Ganutraya is best. When there is no evacuation of bowels, Amritottara is best.
Very apt answer, sir. Thank you, sir. Sir, next question. Sir, from Pooja. Respected sir, what is the treatment protocol for excessive Hasta Sweda?
Yeah, Hasta Sweda. Yes, yes. That's a common thing we are getting. Many of the, I think it occurs in the age of adolescent and also up to 20 years, 10 to 20 years, some of the people, students, etc., they are getting these problems. In such conditions, the very effective medicine we used to prescribe is Tiktagagridam. It is due to the Pitta Dushana only, Pitta Vardhana only, and Girdapana, Tiktagrida is very effective in this condition. Some of the cases where they don't like this Tiktagrida means we can utilize Kashaya also. But Pitta Samshamana is the principle behind it. You can advocate Tiktagrida or Mahatiktagrida for that.
Yes, sir. Sir, next question. If continue sneezing twice or thrice every day with watery running nose, is it because of kapha or pitta? And line of treatment also, can you please explain?
Yeah, that's a real question, I shall tell you. The running of the nose can occur in two conditions. One is due to kapha and one is due to pitta. I shall tell you that. When allergic conditions, allergic eosinophilia, in such conditions, modern we are diagnosing that it is due to allergy, means in such conditions, kapha is increased. And we will get good result in such conditions by Kabhagna Chikitsa, Kabhara Chikitsa. For that, we can advocate many kashayams are prescribed in them, like that Dashamula Gadutraya and also Pathyaksha-Dhatyadi Kashaya. All Pathyaksha-Dhatyadi is very good in such conditions. And Vilyadi Leha can be given, Oshadi Vadaga can be given, and and we have to tell the patient rather than these things, you have to identify what are the allergic factor in that patient. So there are allergy tests are there, and I used to tell some of the things which chira, it increases kapha, and chocolate. Many of the children they may be taking chocolate, and water will be taken from the fridge, etc. Cold water. In such conditions, and also smells are the allergic conditions like. Sandal, bati, etc. In such conditions, you have to find out the cause and avoid it. And in Paithya condition, there is one condition where it can be. In Chikitsa Manjari, he says, when pitta is increased in the head, in such conditions, there is a condition where the sneezing or srava can be occurring due to the increase of Ushna Guna in the body, in the head. In such conditions, some of the tailas applied in the eladi coconut oil, etc., and nimbamradadi coconut oil, etc., When applied in the head, it will be decreased. When after jwara, after taking medicines, etc., without taking snana, etc., still the running nose will not subside. In such conditions, if we apply um, appropriate thaila in the head, it will be stopped. So these are two conditions.
Okay, sir. Thank you. Sir, next question from Dr. Ujjwala. Sir, if obese patient come with chronic constipation, as we give first pajana, then shodhana. So this condition is okay. When given shodhana with pachana, can we give shodhana with pachana?
Yes, certainly. See, Abhipattikara Churna, it is Pittagna and also it is Deepana, Pachana and Shodhana. There are some of the medicines like Amritottaram. It is Deepana, Pachana and also Shodhana.
Okay.
So that is the main benefit of the Kashaya Yogas. Kashaya Yogas, they it has got some intellect. The Kashaya itself has got an intellect. It specifies all the things. That yoga is made according to that. Different systems are managed. Not only one system, not only the digestive system, not only the respiratory system, cardiovascular system. Everything is, it has got an arrangement that it controls all these sections. So we can have it. Okay.
Sir, we have Ujjwala here. Ujjwala, you can speak.
Sir, good evening, sir.
Please, can you increase the volume of your...
Hello. Hello.
Hello, Ujjwala, can you please increase the volume of your microphone?
Hello.
Sir,
are you able to listen to her, sir?
No, I don't hear anything. Let her, you please tell, she can chat and tell. You can read it and tell.
Okay. Actually, sir, she is doing counseling for the same patient every week. And before she had asked a question about Pada Daha. For this patient only, she is asking. Pada Daha, which is not reducing.
Yeah. No, I shall tell you. We can go for counseling, that is good, to relieve the causative factors. Otherwise, symptomatic Vyadhi Viparita Chikitsa also can be adapted. In such conditions, Shatadavsa can be applied for the parts where this Daha occurs, and also Tikta Kashaya, Tikta Grida, etc. can be given if it is suitable. And Pittagna Chikitsa should be done. Vada Pittagna Chikitsa will be benefited in the cases of Alpanidrada, and Tirabala can be applied in the head and body also. Shatadavda Grida can be applied in the body parts where Daha is there. It is very much effective. Tirabala 101, etc. can be applied in the head with Kachoradi Churna or Rasnadi Churna, which gives very good result. Even there is Manasa Mitra Vadaga, if it is, if she has got any mental problems or just Anidrada, if it is there, it can be undertaken.
Okay. Okay, sir. Sir, another question. Treatment and principle of Brahma, migraine, tinnitus, arochaka, leukoderma, etc. Sir, can you please tell us the treatment principle of Brahma?
Brahma occurs due to Pitta and Vada. Pitta is the main thing in Brahma. Like in the anemic and Pandu, etc., Brahma is the main thing which can be seen. So, Pittagna Chikitsa will be very much effective in the conditions of Brahma. So, see, even in Pandu, we can see Kalyana Grida and also Tiktaka Grida are explained. Pitta Kushta Parisarpa, these things, Brahma, etc., can be relieved by Tikta Grida. And Mahatikta Grida can be advocated. Even some of the cases where Kalyana Grida also can be utilized. It has for special activity in the Urdhva Bhaga, so it can be given. Even Pandu Kalyana Grida is used where Brahma is there, so it can be advocated. But we have to see what is the causative factor behind the Brahma. Brahma can be a symptom can originate in many conditions, even in the conditions of labyrinthitis vertigo. We should address that condition. Even cervical region erosion, etc., cervical bone erosion, or disc prolapse, etc., cervical disc prolapse, that also may sometimes result in Brahma. So we have to find out, or we just by the increase of pitta or amla pitta, Brahma is occurring. So we have to advocate such things in accordingly medicines for that amla pitta. So we have to find out the causative factor and treat accordingly.
Okay, sir. Sir, can you please share your experience of treating Down syndrome?
Yeah. I told you in that case itself, she was having Down syndrome. But Down syndrome should be treated not only by medicines. We have to give her training also, educate her, and also there are some protocol for Down syndrome, how to manage. That can be advocated. Otherwise, we have to advocate Ayurvedic medicines. One of the main thing I used to give is Kalyanaka Kashaya. Kalyanaka Ghrita can be is prepared as Kashaya, and or Kalyana Ghrita can be given. Even some of the cases Panchagabhya Ghrita is very much effective, and there is one there's a specific yoga told in Harita Samhita. That is, we have made that Gurujika Apamarga, Bidangam Shankhapushpiga, Vishnu Kranda Vachapatya, Nagaram Cha Shadavadi, Churnam Gridena Sambishram, Lihato Dhi Pravartade, Tribhirdine Sahasragam Shoganam Avadhare. So that is very much increases the IQ level. Such things can be advocated, and we have prepared that medicines and given for many of the Down syndrome. But we should tell them it is a pratyakhyana chikitsa should be. It cannot be fully relieved, but improvement can be seen in the Down syndrome. Many medicines can be advocated according to the condition of the patient, age of the patient, everything.
Okay, sir. Thank you so much. Sir, if you are fine, can we discuss a few more questions? Sir?
Dr. Radhika.
Yes, sir.
Dr. Sadishan, Onnur Ayurveda College. Where this Dr. Sadishan, your father is Sadishan.
Yes.
He is from?
Sadishan, Vaidyaratnam Ayurveda College.
Yeah, that's good. He was my friend.
Yes.
I did not see you. That's why.
It's okay, sir.
That's nice to see you.
Yes, sir, very much.
I remember your father.
Yes, sir. I am also very much happy to see you, sir.
Yeah.
Sir, if you are fine, can we go for a few more questions, sir? Just few?
It's a 10 o'clock.
Just two more questions, sir.
They can have, I have given my phone number. They can have contact me in the WhatsApp number.
Okay.
Anything I shall reply for that.
Okay. So just last two questions. One is, sir, in chronic renal failure, after Shodha is reduced and the patient is having more creatinine level up to 5 and patient feels weakness, what should be the line of treatment?
such a severe conditions, the question is okay. But we have to see many things to treating CRM. Uh, Normally, they will be going on through dialysis, etc. sometimes, or modern medicine can be given. And that doctors will tell you have to take very less water and diuretics should be avoided sometimes, they may say. So, looking all these things, I used to prescribe in such conditions uh, a medicine which is very favorite for me, that is Punarnavadi Kashaya. Punarnava is not a diuretic as such. From my clinical experience, Punarnava is rejuvenating. Nava, new. It rejuvenates the body. So it works as a rasayana. And so that is what I used to give. Not much medicines because it cannot be advocated in CRM. This Punarnavadi Kashaya as such can be given very good. It gives a result also. It's a rejuvenation of the kidneys.
Okay. Okay, sir. Thank you so much. Sir, one last question. With that, we will end the session here.
Yeah.
Sir, the question is asked by Dr. Vishakha. She is stating that she has a patient who had undergone bilateral femoral thrombectomy after silent heart attack post-COVID in November 2021. Now on anticoagulants. She still developed a stricture at the surgical point. History of DVT 12 years ago post pregnancy. So,
Yeah.
can you please tell us any lead to do the treatments?
We have to see the condition of the patient, how he is. We have to think about it, and it takes some of the other things also to know to suggest a medicine for that. Certainly, we let her chat in the
Yes, sure, sir. I understand.
WhatsApp.
Sure.
I shall reply.
Yes.
Okay.
So, Dr. Vishakha, you can directly contact sir so that he can help you have a good
There are
treatment.
many questions I should ask her. What is the condition of the patient?
Right,
Everything we
sir.
have. Then only I can tell what is the proper thing we can advocate.
Right, sir. Right. Sir, with this, we are winding up our session over here. So once again, I know thank you won't be an enough word to tell you because you have given us such a good insight to the basics of Ayurveda and telling us how to use this basics in your practice. So once again, on behalf of Ayurveda Map and personally, I thank you so much for this session, sir. Thank you very much.
I'm very happy to see you, Radhika.
Thank you.
Your father was very familiar to me and a very good friend of me.
Thank you, sir.
Yeah.
Thank you. Okay, to the participants, I have given you the unmute option. So, if possible, if you can just give us a few feedbacks about the session, it would be very nice so that we can help improve ourselves. And also, if we get a few good feedbacks, also, it will be really a good thing for us. So any of our participants who can just give us a few feedbacks, please do it. You can unmute yourself.
Yes, thank you, sir. Thank you very much for the session. And we have a lot of feedbacks in the chat.
Yes, Dr. Anusruti, you can speak, Anusruti.
Okay. Yes, we have a lot of feedbacks in the chat box. Thank you. Thank you so much. Yes, anyone can speak right now.
Hello, sir. Namaste.
Yeah.
This is Dr. Nagesh Shavi.
Okay, okay.
Sir, very nice, useful session. As a starting session, very important for us to know the dosha, dusha, and prakriti siddhanta itself is a basic thing for understanding the prakriti and disease and diagnosis and the treatment. Thank you very much for your elaborative lecture on this, sir. We enjoyed the session and we understood so many things. We clarified our so many misconceptions regarding dosha, dosha, siddhanta. So it again acts as a catalyst for us in future, sir. Thank you very much, sir, for your
Thank
kind.
you, Nagesh, for good comments. Thank you.
Thank you.
Thank you, Dr. Nagesh. Anyone else who would like to give us a good feedback?
Sir, namaste, sir.
Namaste.
I'm Dr. Vishwanath, sir, from Karnataka.
Yeah.
So it was really a wonderful session, sir. The basic concept, what you have told, it was really good thing, and you teach very well, sir, with a great patience and all. So I'm really happy to hear your voice, sir. Thank you very much, sir.
Thank you, Dr. Vaidya Vishwanath.
Hello.
And again, sir, thank you very much for team Ayurveda Map for conducting such a wonderful session like Rekha. Because seeing the faculty itself, I joined. I'm very much interested to listen all the lecturers in coming days. Thank you, sir.
Thank you,
Thank
Dr.
you.
Nagesh.
Hello.
Yes, Dr. Vishaka,
Yeah.
please.
Thank you very much, sir, for the insight. It was really wonderful. And the basic thing what I came to get to analysis is the Atma and the Man and Indriya. Usually it is more of the sharir that we keep on focusing on, and we forget the aspects which are more deep and substantial. So this was really insightful, and the Siddhants, so it was a very good revision. Thank you so much for your what I would say your lecture, and it was a wonderful session. Thank you very much, sir.
Thank you, Ishak.
Thank you, Dr. Vishaka.
Hello. Hello.
Anyone else who would like to give us a feedback?
Hello.
Okay, so I guess we will wind up the session here. We have got a lot of good feedbacks in our chat box, and we are really happy to have a great session. And also, it was a wonderful session starting with you, sir. Thank you so much once again. Thank you. And thank you all the participants for joining us in this Rekha session. So, looking forward for more wonderful sessions. Thank you very much. Thank you once again. Thank you, sir.
Thank you, sir. Thank you very much. And good night.
Good night.